Varicose veins are enlarged, twisted veins that often appear blue or dark purple, and are typically seen in the legs. While they may not always cause complications, they can lead to various issues in some cases. Here are some potential complications of varicose veins: pain and discomfort. Varicose veins can cause aching pain, throbbing, and discomfort, particularly after long periods of standing or sitting. This discomfort may worsen as the day progresses and can impact daily activities. Swelling. The affected area around varicose veins may swell, leading to feelings of heaviness or tightness in the legs. Swelling can exacerbate discomfort and may be more pronounced after prolonged standing or sitting. Skin changes. Over time, varicose veins can lead to changes in the skin around the affected area. This may include skin discoloration, redness, or a brownish appearance. The skin may also become dry, itchy, or irritated. Venous eczema, stasis dermatitis. Chronic venous insufficiency due to varicose veins can cause inflammation of the skin known as venous eczema or stasis dermatitis. This condition may result in red, swollen, and itchy patches on the skin, typically around the ankles and lower legs. Ulcers. In severe cases, chronic venous insufficiency can lead to the development of venous ulcers, also known as stasis ulcers. These are open sores that typically form on the lower legs, particularly around the ankles. Venous ulcers can be painful, slow to heal, and prone to infection. Bleeding. Varicose veins close to the skin's surface may be more prone to injury. Minor trauma or injury to these veins can result in bleeding, which may be profuse in some cases. While the bleeding is usually not life-threatening, it can be alarming and require medical attention. Superficial thrombophlebitis. This condition occurs when a blood clot forms in a vein near the surface of the skin, leading to inflammation and pain. Superficial thrombophlebitis may cause redness, warmth, swelling, and tenderness along the affected vein. Deep vein thrombosis (DVT), although less common. Varicose veins can increase the risk of developing a blood clot in the deeper veins of the legs, a condition known as deep vein thrombosis. DVT can be serious, as the blood clot may dislodge and travel to the lungs, causing a pulmonary embolism, a potentially life-threatening condition. It's essential to consult with a healthcare professional if you have varicose veins, especially if you experience symptoms such as pain, swelling, skin changes, or ulceration. Treatment options are available to manage symptoms, prevent complications, and improve the appearance of varicose veins. Call 0300 413 0159 for an appointment with Prof. Zahid Mahmood at Hameed Latif Hospital Garden, Town, Lahore.